If you see overgrowth of staph or strep, I am always thinking like, what is happening in the sinuses or what's happening like in the throat? So either if I see a lot of strep, I'm like, okay, are you a strep carrier? Did you have a lot of strep as a kid? Or are you having overgrowth in your sinuses? And then you're constantly swallowing all of these secretions. And if they're not dying in the stomach from this like strong stomach acid, they can get down lower into the gut and cause issues with your gut microbiome.
Dr. Stocker, it is so great to have you here. I watched your presentation at Gastro AMP 2023, and I was just like blown away because you talked about the sinus microbiome, which fascinates me, I have to be honest. And I shared about us having this conversation today with my community, and they were like, I am totally all in for this because I think we're so fascinated by the different connections of microbiomes in the body. So thank you for being here. I really appreciate it.
Thank you for having me. I'm so excited to talk about this. I love talking about the microbiome, everything, nose to anus. I love it.
Well, let's dive into what exactly is going on with the sinus microbiome. So can you talk to us a little bit about what it is, the makeup, and then when things go awry, is it possible for us to have an overgrowth?
Yeah, definitely. There definitely is a possibility of having an overgrowth. And we see that quite commonly for people that have chronic sinus issues or even acutely with acute sinus issues that people have. So just like anywhere in your body, like just like in your gut or in your mouth, you have a microbiome in your sinuses and in your nose. And we don't really know. There's new research on what this kind of looks like, but it's not really well categorized, and that's because it's really hard to figure out what's going on in the nose because a lot of those microbes die once they're exposed to air. So we have to come up with technology that can kind of sequence them and figure out what the heck is going on in there without exposing these microbes to air, so we can get an understanding of what the composition should actually look like. But what we do know is there is dysbiosis or an imbalance in the sinus microbiome, and we can see overgrowth. So we can see overgrowth of fungi, we can see overgrowth of staph and strep and pseudomonas, and all of these things can cause a change in inflammatory cascades and activation of the immune system, and that's when we really see symptoms of chronic sinus issues.
So when you said there can be fungal overgrowth in the sinuses, I was like, well, first of all, inside of my inside voice was like, of course there can be. But then outside I was like, oh my gosh, someone is saying this. This is amazing. Yeah. I know, I get so excited by these little things. So can you talk to us a little bit for anybody listening to this who never thought that you could have fungal overgrowth in the nose? Tell us a little bit about that.
So this can happen for a variety of reasons. It can be from mycotoxins, so mold illness, right? We know that there's certain fungi that produce toxins, and then those toxins can kind of create changes in the sinuses. They create biofilms. They create reservoirs of these other bacteria that help protect them. They're all about like protecting each other. These like kind of bad microbes protect each other. It's also normal to have certain fungi in the nose as part of that normal community. And when something goes awry, like whether it was antibiotic use or another infection like a cold or flu or COVID or something like that, it can allow for overgrowth of the more dominant organism, right? So like fungi or different bacteria.
You also mentioned something to me in the beginning before we started recording about how there's this weird connection between, I think you said fungus and staph.
Yes. Yeah. So what we have found through research is that they can coexist, and overgrowth of certain bacteria or fungi, what they can do is they protect each other, right? They protect each other in this biofilm. They cause disruption in the barrier. So this is a similar thing as leaky gut. It's like leaky nasal epithelial barrier. And this leads to colonization and overgrowth and biofilm formation. And then what happens is there's an overgrowth and it changes the immune system response, and we can see more mast cells in the area, and then they are releasing histamine, and that's when we get a lot of those symptoms of the chronic sinus issues, like the stuffy nose, the runny nose, all those like hay fever type symptoms that we kind of get and we think about.
And so I just want to double check that we covered this. So when we're talking about the nasal microbiome, it's not just inside the nose itself. It goes back into the sinuses, yes?
Yes, they're in the sinuses. So our sinuses that we're kind of thinking about are maxillary sinuses right there, like in the front of your face, that ethmoid sinus, which is like the one that's behind the bridge of the nose, and then the frontal sinus that you can kind of feel over your eyebrows, right? And generally, like when we're trying to assess these things and we're trying to do either a swab to kind of get an idea, we're trying to look at what's happening in the middle meatus. So it's kind of part of the sinuses. When we swab it, it's not going up into the nose, because that's not going to give us a good representation of what's happening in the sinuses, because we have different microbes in the nose than what should be in the sinuses themselves. So we're trying to get a sample from the middle meatus, and that's kind of like if you put your finger on your nose and your finger on your ear and we draw a straight line, that's where we're trying to sample and get a good idea of what's happening there.
I had no idea you could even do this. I find this so cool. And I know for those who've struggled with sinus issues, I know that I don't have these issues, but I can appreciate those who can be in a tremendous amount of pain, having pressure and all sorts of things. So with having an altered sinus microbiome, are there any other comorbidities or concerns that we should be aware of that could happen, or maybe that there's a comorbidity if you have this, you're at a greater risk to have an altered sinus microbiome?
Yeah. So think about any autoimmune condition. Okay. First of all, lots of gut problems. So GERD, acid reflux, heartburn, IBS, are all comorbid conditions that can be implicated in chronic sinus issues. So in what we're learning, and this is like really interesting to me, and I think it's cool to understand this, is that we're kind of coming to understand that changes in the microbiome can trigger autoimmunity in the nose. And then what are the implications of that systemically? So like with things like psoriasis and psoriatic arthritis, things like eczema, we see these all have connections with altered microbiome in the sinuses.
This episode is brought to you by my skincare line, DermaQuell. The beauty of these skincare products are that they are especially crafted for those struggling with chronic skin rash issues based on my research and clinical experience from my private practice. They focus on organic ingredients that are clean, like zinc, aloe, and hemp oil, that support and calm rashed, dry, angry skin. There's no unnecessary chemicals or additives that can further dry out your skin or mess with your hormones. And I'm so excited for you to add these creams into your routine. Check them out at quellshop.com and use the coupon code GET15OFF to get 15% off your first order. I'll put a link in the description below, and now let's jump back to the video.
And I was going to say too, I know from looking at research and working with clients that, for example, you mentioned H. pylori, and if we have that lower stomach acid level where we no longer have the chemical barrier we need to kill things, anytime we swallow, so if you've got a messed up microbiome in your mouth, you're swallowing this bacteria down and it's making its way into the GI tract. So, and I'm just thinking out loud here, I would imagine we also swallow mucus. So that could be another route, correct? That you could end up getting organisms into the GI tract, yes?
Yes, definitely. And I think for those of us that do a lot of comprehensive stool testing, this is like a pattern you probably see is if you see overgrowth of staph or strep, I am always thinking like, what is happening in the sinuses or what's happening like in the throat. So either if I see a lot of strep, I'm like, okay, are you a strep carrier? Did you have a lot of strep as a kid? Or are you having overgrowth in your sinuses? And then you're constantly swallowing all of these secretions. And if they're not dying in the stomach from this like strong stomach acid, they can get down lower into the gut and cause issues with your gut microbiome.
Yeah. Would nasal drip be a potential sign to you that there is something going on in the nasal microbiome, or can that also indicate something else?
Yeah, so when it comes to post-nasal drip, if it's actual post-nasal drip that's coming out of the sinuses, it definitely makes me think clinically what is happening in your sinuses. But we do have to make sure it's not GERD, like actual reflux getting all the way back up into the throat and causing irritation in the throat that kind of mimics postnasal drip. But if it is postnasal drip and people know, if you have postnasal drip, you know that feeling, even if you don't have it like all the time, you know that feeling from when you're being sick, that like drip, drip, drip in the back of your throat. And it can get painful and you can have a sore throat, just like if you had acid refluxing all the way up to the back of your throat.
That I didn't realize that. I don't know why. I guess because I don't work with a lot of really like more severe GI issues. So I didn't think about that idea that, and many people probably aren't, that it could be a sign of actual reflux that's getting up a lot higher than just having maybe some burning in the sternum area.
Yeah, it can reflux all the way back up, and those are the people that like complain of like sour taste in the mouth or chronic sore throat. That we're like, why do you have a sore throat? And it's not an infection; it could be just the acid reflux coming all the way back up.
And so, we talked a little bit about the different organisms that could be overgrown in the sinuses. But there's also that issue where somebody's really stuffy, like the face feels like inflamed, like the tissue of your face, you're like, oh my gosh, I have this so much pressure. So is it possible that inflammation driven by this, whatever is happening, an immune response, can you talk a little bit about that, of the immune implications of how or why somebody might be getting so much pressure in the face?
Yeah, so anytime we have an infection or we have a just dysbiosis, it's changing the immune response. So both the innate and the adaptive immune response within the sinuses. And so then we see more cytokines being produced by the immune system, the more pro-inflammatory cytokines. And that's when we can see the swelling, the signs of inflammation. There's also, like we had previously talked about, that mast cell response. So if we have high reservoirs of Staph aureus, we're gonna see more symptoms of mast cells, and we're gonna see that histamine response, which are those classic hay fever symptoms that we kind of think about when we have allergies or when we have chronic sinus issues, runny nose, itchy eyes, and then the swelling, because mast cells create swelling. Just like systemically we see hives, right? Similar responses happening within the sinuses.
Now, I thought this is kind of something I think about from my dad, who was an ophthalmologist. He always told me, look, if whatever you put in your eyes, you could like taste it sometimes in the back of your throat, like eye drops and things. So, but he said, like, when you blow your nose too hard, you can cause issue with the eye. Like, it's kind of all connected in this area, right? So is it possible, and it's okay if you don't have any data on this, but just your thoughts, is it possible if you did have, say, an infection like staph overgrowth, MRSA, something like that in the nose, do you think that could also impact the eyes or the eye? Like, I mean, we have an eye microbiome. Do you think it could impact other areas beyond the nose and the face? Like, you know what I'm saying? Further out.
Yeah. Probably. Definitely. I don't have data on that. don't know a lot about the eye microbiome, which I'm super interested in, right? Because I see a lot of patients that have rheumatological conditions, and so they have inflammation in the eye. So now I'm like getting curious just from this conversation we're having about like what is happening with their eye microbiome, and that's something I'm going to look into more. But it makes sense to me that like, because what we know is like if there's alterations to microbiomes anywhere, like whether it's on your skin, whether it's in your mouth, in your gut, they all affect one another. So it makes sense to me that, especially being so close, that if we have alterations in the sinuses, something's going to happen with the eye or vice versa.
That's just my theory.
Yeah.
My dad's no longer around to be able to answer this question. I'm sure he would have had an interesting answer with all of his research he did over many years, but it is a question now that I am searching for. But I'm so glad for this conversation, because the truth of the matter is, I never thought, like, aside from doing like a swab, like sometimes you can go to like, sometimes clients can get their doctor to do like a nasal swab, or they'll get that like Marcan's test. But how do we test what's going on up in the nose and in the sinuses? Like if you wanted to go that route, how do you even do that?
Yeah, so traditionally we did a lot of cultures, but cultures aren't great at sampling the microbiome in the sinuses because so many things die once they're exposed to the air. I think the last data I saw, if we do a culture, it shows like 1% of the actual microbiome in the nose. So there's new ways of sequencing. We can either do PCR testing, which we do a lot for stool testing, but then we have to know the exact microbes we're testing for. So that gives us an idea if we're testing for like 15 or 20 microbes. But what I think the future of testing is, and what I've been using a lot, is next generation sequencing, which these companies have these libraries of like 50,000 microbes, and they're able to test the sample against their libraries with like 99% accuracy. And that is really helpful because then it helps guide our treatment plan, because they're able to look at antibiotic resistant gene markers and to tell us really what is growing in the nose if we need to target therapy using different antimicrobial agents, whether they be antibiotics or antifungals, or what will actually work. Because what I see so often is people that have chronic sinus infections or chronic sinusitis, is they just get put on like a whole gamut of antibiotics, like antibiotic after antibiotic after antibiotic. And eventually they just like stop working, or they run out of antibiotics and they have to be on the harsher ones that really affect them systemically. And that's just like a Band-Aid, right? They're kind of just like taking the load of the infection off, but it's not targeting and killing the cause of their imbalance. And they're also not doing things to reestablish the microbiome, right? Just like in like gut stuff, like if we use antimicrobials, like either antibiotics or herbs or whatever it is, we also need to do work to reestablish a healthy ecology and a healthy gut microbiome. So the same thing happens in the nose. We need to kill with more precision and then do things to reestablish a healthy balance.
And can I ask you too, one of the pearls that I took from your talk at Gastro AMP was, I never thought of this before, that if you use a swab up the nostrils, you're really only getting that area. So what might be a better option if somebody's really limited right now and they're just trying to like they can get a culture, like that's what they can get? What would be maybe a smarter workaround?
So it depends on who you're going to, right? Like if you're going to an ENT doctor and they're doing they're really good at swabs because that's all they do. They're going to get a good swab back there. But if you're just, going to someone that maybe isn't comfortable doing a lot of those deep swabs, you can blow your nose. So what I have patients do is I will do a swab, but then I will also have them forcefully blow their nose, like really trying to get all of the mucus, all of the stuff that's in there, blow it onto a clean tissue and swab that baby. Get as good as a sample as we can, trying to get really like all the gunk, right? Like all that stuff from way back in the sinuses, and so we can sample that.
Yeah. I think it's fascinating to know that there are other options. And I think for the doctors and other providers listening to this, my hope is that this inspires some curiosity to start looking in other corners that could help you get much better results for your patients. Because I mean, ultimately, at the end of the day, I think all of us have a shared goal of helping people get better sooner. And my hope is when we can like bring our information together and we can put our heads together, maybe we can start helping people in ways that like, I didn't think of that. You didn't think of that. But like all of a sudden we're like, oh yes. And it moves the process forward, you know, and helping people get answers sooner rather than later. It's always my goal. It's my dream.
Yeah. Yeah, no, I love that. That's my dream too. It's like, how can we get people feeling better so they can go and live their best life, like to do the things that they want to do and spend the time that they want to spend with the people that they want to spend it with. Like that's always my goal. And I think that's really well put. Like exactly my same goal with patients is like, how can we just get you feeling better? And how can we figure out like with the microbiome or with whatever we're looking at to decrease inflammation in the body so you can live just like a healthy, happy life without having this burden.
You don't get the time back.
Right? Exactly. Yeah. Exactly.
You don't get it back. So let's talk about some treatment options because I think in terms of the sinus microbiome, you mentioned like a lot of times it's just antibiotics, I guess antihistamines, decongestants. I mean, that's like what I'm thinking might be pulled out of the hat. What are some other things that people, obviously you should always talk to your provider first before taking action on things. The only reason I say that is my dad was the one who told me like your eyes are an extension of your brain, your nose and the nasal passages are close to the brain. So like we always want to be careful what we put in those areas.
Definitely.
So everybody
that is my cue to say, like, if you do neti washes or anything like that, we're not using tap water. We're using distilled water. We're using water that's been boiled for at least 10 minutes and then cooled down just to protect yourself from the weird stuff that can be in water because your sinuses are so close to your brain and we don't want to get any sort of infection that is bad, you know?
Yeah. Well, do you, like, if someone is to do that, let's just start with that. Sinus rinses, neti pot, lavages, that kind of thing. What about additives? So, like, there's some people have asked me about probiotics. Is it okay to add probiotics to it? What's your thoughts?
I think when we're thinking about probiotics, like I really like, because the mouth and the sinuses are connected, I like to do swish and swallow. So it kind of gets up because our nose is draining into our mouth, like we know, and we can kind of seed things up in there. I think it's also dependent on how inflamed you are, because if your sinuses are so inflamed and then we either put probiotics up into the nose or we swish and swallow them and they don't have a way to drain out, we can create an infection. And that's like the opposite goal, right? So yes, the probiotics can be helpful because they can outcompete those bad microbes, but we need to make sure that things are open enough that it's not going to create more of an issue.
Yeah. What about adding herbs to the water? Or we live in the day and age that essential oils are so readily available. What are your thoughts on those?
I get a little cautious around essential oils, especially putting them on mucosa, right? Like very delicate skin, because they are caustic and they can cause damage to that tissue. Another thing that I always like really have to think about is this thing called mucociliary clearance, which is basically just the beating of those ciliated or hair-like cells that are clearing our airways. And if we put things that are going to kill them, we're not going to get things out, right? Because we need those cells to be beating and moving things out of our airway for us. So we're always trying to improve that mucociliary clearance to get mucus, to get microbes out of our sinuses, out of our nose. So if we're killing them with with essential oils or other what we call cytotoxic chemicals, it's going to be deleterious to our goal. So that's what I'm always thinking about with essential oils. There are herbs that can be helpful, right? Antimicrobial herbs. And I do love herbs because they tend to be more broad spectrum than antibiotics. So they have less risk of creating oh my gosh, forgetting words right now, but for resistance, there we go. Resistance is like antibiotic resistance because they have more ability to kill a wide variety of microbes.
And do you like, what it sounds like to me is like perhaps stick with saline?
I would say like stick with saline. The over-the-counter ones that are already in the jar, super easy. I like over-the-counter nasal sprays that have xylitol in them, or they have grapeseed extract in them, and they can be really effective for the inflammation and for killing off both the fungi and the bacteria that can overgrow. When it comes to adding herbs into like a neti wash, then it's just really important to make sure there's no like sediment in there, right? So if we're using like whole herbs, you have to make sure you're filtering it really well so you're not just like putting plant material into your nose. If I have patients do herbs, I generally have them use tincture I have them put the tincture in a boiling water because then it's going to get rid of the alcohol because we'll boil off the alcohol, but then we still have the herb compounds in the water, and then we don't run that risk of having like floating plant material in our washes.
Yeah. I think it sounds like you just, again, I think it's always like we have to be more cautious than what we're doing, say, like sending something down the GI tract. I mean, certainly there's issues with that in terms of essential oils and such. Mm-hmm. But I think, again, you have to remember this area of the face is so close to your brain. And like you pointed out, too, there's critical cells here that we don't want to die because they're really important for helping the sinuses do what they need to do. So just a couple quick thoughts. Like, what happens if you actually have a sinus infection, whether it's MRSA or staph or something like that? Is it still okay to do some sort of saline rinse or neti pot?
Yeah, I think it's really helpful. So oftentimes if you're having a full-blown sinus infection, that's when we really need to work kind of as an integrative approach, right? We're using either a steroid rinse, but we're also doing a saline rinse, and maybe using some sort of antimicrobial, whether they're herbs or antibiotics. And I think that like kind of integrative approach is really effective in treating a full-blown sinus infection. So then we can hopefully, and it's not always possible, but hopefully avoid oral antibiotics for those people.
And for somebody who's just, they have chronic stuffiness and chronic sinus issues, how much is too much in terms of doing like saline rinses or the neti pot?
I think doing it once or twice a day is totally safe. Doing it more than that is probably not beneficial. And we do run the risk of damaging those little delicate ciliated cells in there, which we really want to keep them nice and healthy.
Want to keep them moving and doing what they're supposed to do.
Exactly.
Yes. And do you have any tips for anyone listening where they're like, well, like me, I don't have sinus issues, generally speaking. If you wanted to support your sinus microbiome, any thoughts on what we could just do in general that you think, based on your research and working with your patients, might be beneficial?
Yeah, I think it's really important to make sure your home or office or wherever you're spending time has a good amount of humidity, right? So we're looking for 50 to 60% humidity. We don't want much over that because then we run the risk of mold overgrowth, which is not what we want, but we don't want too dry of environments. We also want to decrease the amount of smoke or other pollutants that we're breathing in, because that can damage those ciliated cells, and it can alter the microbiome in the sinuses. So making sure you're breathing clean air and you're not exposed to different chemicals and volatile chemicals, especially. So if you're doing any hobbies or working with any chemicals, you're using that personal protective equipment to really protect your nose and your sinuses and your nasal microbiome.
I love it. I love all the things and obviously this is an evolving microbiome science space. We will probably know more in like 2-3 years, I would think. Yeah. But I think it's fascinating. And I just want to make this final point, because you're not like a ENT. You work in rheumatology. And you shared with me that you at first didn't ever ask anyone about this unless they maybe mentioned something. But now, do you want to share your thoughts on that now? Being that you're in a I just think it's an important thing to hear.
Because of all the comorbidities of having sinus infections, and because I work in rheumatology, so what I'm always doing is looking for triggers to the immune system. My goal is always trying to figure out what is triggering your immune system that is causing autoimmunity, and how can we remove or decrease those triggers. So at my first office visits, I'm always looking for like reasons why we have infections, right? So UTIs, history of ear infections, strep throat, any signs or symptoms of gut dysbiosis, right? Trying to figure out those triggers. And then eventually, like, people would be like, oh yeah, and by the way, I get 6 sinus infections a year. And then I started like making these connections of like, well, if we're treating the oral microbiome, like getting people to go see their dentist more, getting people to do better oral hygiene, they're kind of getting better, but they're also getting like this sinus thing. And then eventually I was like, I just have to ask everybody about their sinuses. So that's part of my like first office call now, is being like, do you have any sinus issues? What's going on with that? Because what was happening was like down the line, you know, like a few visits in, people are like, oh, or like it would come to fall and they'd be like, oh man, I'm getting a sinus infection, or the seasons changed and the different, you know, allergens are in the air, and they're like, my sinuses are acting up. And it was like, oh, we need to be looking at the sinuses as a potential trigger for their autoimmunity, and how can we try to balance this to remove that as a trigger for their autoimmune disease process.
I love it. I love when people think outside of the box. I just love it. It excites me so much. I know that it's probably not exciting. It probably is exciting and yet not exciting for somebody who's dealing with chronic sinus issues, because they're just like, can we get this to stop? But yeah. I think it's fantastic that we're starting to look at these different things and create connections where maybe we didn't even realize there might be one, so that, like you said, we can better serve people and help people get better sooner, right? So I appreciate that about you. And we had your colleague, Dr. Jenny Bennett, on the show already. You also practice at ARIA Integrative Medicine in Seattle, Washington, and you are taking patients, correct?
Yes, I am. Yeah, me and Dr. Bennett, we work closely side by side. We like to talk about cases. It's something we really enjoy. Yeah.
Awesome. Well, we'll make sure to put all of the links, especially for those who are interested in getting in touch with you, into the show notes. And I so deeply appreciate you coming on the show, and I hope we can have more conversations like this in the future.
Thank you so much. Thank you so much. It was a lot of fun.
If you enjoyed this video, you need to tune in to this video next. Then make sure to hit the subscribe button so you get notified as soon as a new episode drops. I'm excited to see you there and dive deeper with you on your skin healing journey.